Hello, everyone, and thank you guys for attending the specialty series hosted by SNMA. Specifically, we're going to be talking about the surgery track. My name is Taylor Farrow. I am a current fourth-year osteopathic medical student and your current national treasurer here on the board. And welcome to the start of the Sowing Seeds Specialty Series. This week, we'll focus again on the specialty of surgery. This series is a part of our Sowing Seeds program created during the pandemic and continued by our National President Chantel Thompson in collaboration with the Alumni Affairs Committee. Throughout this year-long program, we will provide resources on how to succeed as a pre-med and medical student, and we'll touch on everything from financial literacy to preparing for board exams and more. So make sure you are a national member by visiting the snma.org and signing up and to stay in the know. So we have a number of panelists today to help talk about things in surgery and kind of their experiences and to also answer a lot of your questions. So I'll go ahead and introduce our panelists today, starting with Dr. Marissa Christinia, excuse me. She is currently a PGY4 general surgery resident, also doing a rural surgery track at the University of Minnesota. Thank you for joining us.
Thank you for having me, for inviting me to this. This is exciting, being able to interact with medical students and help respond to any of your questions. I went to medical school at TCOM, which is Osteopathic School in Fort Worth. And so, and now, as mentioned, I am in general surgery residency at the University of Minnesota. Specifically, I'm in the rural track, and so I'm happy to answer any questions that you might have on what that means and what that entails. I did initially start my residency path in internal medicine and switched to general surgery, so a little bit of a winding path there, but I am happy where I'm at now and happy to answer any questions that you might have.
Awesome. Thank you. We also have Dr. Olivia Means. She's a PGY4 integrated plastic surgeon at the Spectrum Health at Michigan State University. Welcome. Alrighty, we also have Dr. Michael Robinson. He is an assistant professor of surgery at UCLA, as well as a minimally invasive general and robotic surgeon. Thank you.
Thank you for having me. Really appreciate being here. I was just in a lot of the resident shoes and the fellow shoes and also in the shoes of the pre-meds and the medical students. So it's really nice being here. I'm not sure if we're supposed to start now, but I did my training at UCLA. I went to medical school at UC Davis. I did a fellowship in minimally invasive and robotic surgery, finished in 2019. So I've been on faculty at UCLA for the last 2 years, going on 3. I teach residents. I also work in the community, working with in non-UCLA hospitals and doing community surgery and general surgery at non-UCLA sites. So that's also been very interesting and a unique experience of a sort of a hybrid private practice and academic track. So I have a unique experience with that too. So just happy to talk about that and also my road to coming here.
Awesome. Thank you for joining us tonight. We also have Dr. Brittany Hazard-Bigby. She is a current PGY1 general surgery resident at the University of Wisconsin. She is also our immediate past chair of SNMA. Thanks for joining.
Hey, Taylor, thank you so much for having me. Hello to you all. As Taylor said, I am a PGY1 general surgery resident at the University of Wisconsin. I am a prelim resident, so happy to talk to people who are looking at prelim options for surgery and just talk about that whole process. It's an interesting one, so ask all your questions. We're definitely excited to help you guys. I graduated from the University of Medicine and Health Sciences St. Kitts this past May. When I'm from Houston, Texas. So I went to Baylor University for my undergraduate degree and then the University of Texas for my master's.
Awesome. Thanks for joining tonight. We also have Dr. Rita Akumo. She is a PGY2 general surgery resident at Temple University. Welcome. You are muted.
All right. Yes, PGY2 at Temple University here in Philly. I went to Drexel Drexel University Medical University for my MD and stayed in Philly to pursue my general surgery residency.
Awesome. Thank you for joining. And I just wanted to clarify earlier that Dr. Olivia Means may be joining us a little bit later, so she can do her introduction whenever she gets here. Okay. So we've already introduced the panelists. During this time, we're going to kind of get a little bit further into the background of you guys. And then during this time, all of the guests, if you'd like to shout out any questions, go ahead and put it in the chat and we will get to your questions after the background stories. So the first question is kind of why or how did you come to the decision of choosing general surgery? So Dr. Marissa Christinia, can you please go ahead and give us your answer to that?
Yes, I'm happy to answer. So as mentioned, I did my medical school education at TCOM and the DO school in Fort Worth, Texas. A lot of my training was in a more rural setting, so I got exposure to general surgery and internal medicine, and actually I enjoyed both. I entered internal medicine at the University of Minnesota and decided that there was not enough hands-on and I was missing the operating room. So I reapplied, went through the match and matched this to general surgery at the University of Minnesota and am happy with that. But I think that truly, I can appreciate all of the time spent going into patient care with internal medicine. But as the general surgery resident, I feel like I spend a lot more time with patients, kind of immediately fixing issues and seeing them recover and feel better pretty quickly. And that's enjoyable to me. So that's why I ultimately chose general surgery. And so, yeah, and I'm in the rural track, which gives me a little bit more exposure to things like C-sections, because I'm also interested in international or global surgery.
Wonderful. Thank you. Okay. And what about you, Dr. Robinson? Can you kind of tell us what brought you to pursue a career in general surgery?
Sure. So at UC Davis, in our third year, we essentially had 6 rotations, just like most medical students have. And I actually started off with surgery. I came into medical school not thinking that surgery was the right choice for me. I didn't know if I really liked using my hands. I wasn't sure if I could handle the long residency. I actually was thinking I was going to be an ER doctor or a cardiologist, just because a lot of Black people are dying from heart disease. So I thought that I would have a bigger impact, at least in cardiology or something along those lines. But first time I stepped into the operating room, I kind of felt like I was at home. Just the order of the operating room, the cleanliness, the expertise that you need to use to be able to help people, and the ability to see yourself improve very sequentially and very rapidly actually was something that really attracted me. So then I took that experience and kind of went to my next rotation, which was OB-GYN, and actually was still in the operating room and still loved it, even though it wasn't the patient population that I wanted to see. So then I carried that out throughout the rest of my medical school, and surgery was the right thing for me to do. I always tell students and pre-med students that and medical students that I'm not a big fan of trusting the whole "if you can't see yourself doing surgery, do something else" mantra. I could have seen myself doing a lot of other things. I already mentioned a few of the other ones, even radiology. I like anatomy. I just felt that in terms of a match, in terms of what I like to see with patient care, what I like to see with technical expertise, what I like to see with patients getting better right away. That was the idea that surgery was right for me. And also there are a lot of patients, minority patients, with less access to healthcare who need a surgeon who is, well-rounded and, interested in, health for minorities and making sure there's equitable care everywhere. So there is a need for, in most fields, including surgery, for, that sort of perspective. So that's one of my reasons for doing surgery. And I'm really happy so far.
Wonderful to hear. Thank you so much. And Dr. Bigby, would you like to go ahead and kind of talk about why general surgery and your path as a prelim?
Yeah, so I did not choose general surgery. It chose me. I actually soaked into my spot. And full disclosure, as a third-year medical student, so I was doing surgery when COVID hit. And when I left my rotation, or when we were sent home from our rotation, I said two things I would never do. I would never go back to the Midwest. I was in Chicago at the time, and I would never do surgery. And I am in the Midwest doing surgery. So never say never. I actually had always kind of thought, so my goal is to be an OB-GYN, which obviously is surgery heavy. I love the operating room, much like Dr. Robinson said. Like I love being able to like have the order, and the improvement piece is really important to me, because you notice very quickly, like if your knots aren't very good on day 1 and you practice on day 5, you're like, wow, my knots look really great. So there is some instant gratification there. But I love the operating room, and I wanted to see women, and that didn't work out for me this past match cycle. And so I ended up in surgery, and honestly, the last 8 weeks, so we did not get a July 1st start date. We started in June. So I've been in my residency for 8 weeks now. And the first 6 weeks, I thought I might change my mind and do surgery. That's how much I really loved it. But they allowed me to do a OB-GYN rotation. And I quickly realized, like, no, I want to do OB. But the skills that you get on this in a surgery residency, the grit, the grind, just having to be in such a high pressure situation, and not always being the most well rested. I think there's something to the tenacity that you kind of have to employ, especially as a prelim. And so I'm really glad I was invited to join the session, because I think, while we all want to match on Match Monday, the reality is not all of us will do that. But that doesn't mean it's the end of your journey. And so I'm really excited to be able to like share my story with you guys, but also give those of you who may know or think that that may be a reality for you, that like there's another road that you can take to get where you want to. And a surgery prelim year it's worth all of the sweat and the late nights. So far, so good for me anyways. So
awesome. Thank you so much for sharing your story, because I know that can be a daunting time to be in, because it's so much stress around that time of the year. So thank you for that. And then last but not least, Dr. Okumo, can you kind of talk to us about your path to general surgery and why general surgery?
Yeah, thank you. So my path actually sort of mimics Dr. Robinson's in a way. I came into med school thinking I wasn't going to do anything surgical whatsoever, nothing procedural. I actually came into med school gung-ho pediatrics. So I was setting myself up for a pediatric residency, and I hadn't stepped into an OR at all, no shadowing prior to. And I actually had my surgical rotation last in the lineup for third year. And my first taste of the OR was in OB-GYN, which was in the middle of the year. And I'll be honest, I didn't like OB that much, except for when I was in the OR. I found something like truly exhilarating about being scrubbed in, being over the table, and being able to, like everyone else has said, participate in something that was immediately therapeutic for a patient. And so that sort of excited me and energized me, but then had me questioning my decision to want to pursue pediatrics. And then my surgery residency came along, my surgery rotation came along, and I kind of changed my mind then and there on the first day of the rotation. It was a transplant. We had gotten a call about liver harvest, a harvest, and we flew out. So they flew us out. So we got flew out, and we hopped it on the little plane that they had us on, and they took us to the nearby hospital, and we were there till like 2 a.m. So it was me as the med student with my junior resident and the attending, and we were just doing our work, kind of harvesting all the organs that we were going to utilize for the transplant the following morning. And it was super exciting, and I knew then and there that I wanted to pursue surgery. And so that was kind of my road to a surgical residency.
Awesome. That sounds like a lot of excitement started there. So before my next question, I just want to remind all the guests that are here, please go ahead and put your comments, or excuse me, your questions in the chat, and we will make sure that we get those asked while we are, filling other questions. So next general question is, did any of you guys have any mentors in the field, and how did you guys go about establishing mentorship? And it's just kind of free range, whoever wants to take it.
Yeah, so when I had started looking at general surgery as a viable specialty for me to pursue, or as a lifelong career, I had started reaching out to people that were kind of in the field, that were nearby. So I had some mentors in the Philadelphia area that were great. I joined a few of the surgical specialty groups. So there's the ACS, which is the American College of Surgeons, which is our big overarching governing body. And then the ACS has different branches or regional groups. And so the metropolitan Philly area, which is, because I went to med school in Philly, and I stayed in Philly for residency. That was a good way for me to network. Also, being a part of SNMA was a great way for me to network. I was national vice president the year before last. And I found that as a good way for me to get in touch with kind of people in the field. So one of my mentors is a PD actually in another program here in the area. And he really set me up for success when it came to just kind of, especially since I switched last minute, sort of like getting out there and meeting people, and sort of being comfortable on the trail, being comfortable knowing that surgery was right for me, looking into research opportunities, because I will be taking 2 research years as a surgical resident. So he's been instrumental in that way. And so when I knew I wanted to change, hustling and kind of using my network to build even more of a network was something that was quite helpful.
Great. Do you mind if I go?
Go ahead. Yes.
So I have an interesting story about my mentor, and so I was interviewing for actually medical school at UC Davis, and there was a surgeon who was interviewing me, and very nice gentleman, black male, and we really hit it off. And I said, okay, this guy is great, and I really like him, and I want to come to UC Davis so he can teach me. So I ended up getting accepted to UC Davis and saying, where's that one black, faculty member who was a surgeon? He said, oh, he moved down to San Diego. And I was like, dang. And so I was like, oh man, he was one of the reasons I really wanted to come here. I ended up, really enjoying medical school and going through residency, not really having someone who I could really, purposely, I guess, call a mentor other than people who I grew close to during the residency with research and also during surgeries and, through clinical patient care and other things of that nature. I didn't really have a true person who I would consider like the out and out mentor. So then I applied for fellowship, and one of my fellowship interviews is at Scripps San Diego, where I ended up going for my my minimally invasive surgery fellowship. And all of a sudden, the person that I walk into the room with to interview me is old boy from med school. So Dr. Fuller is had moved from San Diego, from UC Davis down to Scripps to be the program director of the minimally invasive surgery fellowship. So I said, as soon as I saw him, I was like, yeah, this is it. And it was one of the best experiences I ever had. It was 1 year. And I still, reach out to him, talk to him to this day regarding any issues, clinical, non-clinical, navigating, being a Black male in the surgery department, navigating education and academic advances, essentially, and just general life things. So it's just funny, what God will do. He kind of brings people back in your life without expecting. But it's been a blessing, and to me, also with him, kind of circumferentially being my my number one mentor. I want to be that for other people, and I understand how important that is. That's why I really enjoy teaching, love academics, and so it's something that really does is important to me, and it's just pretty cool to have that kind of roundabout story with a mentor. So
that's awesome. I'm glad it worked out in the end.
It's like one of those movies,
right? Awesome. Okay. Would anyone else like to chime in on the mentorship question? We do have a couple questions in the chat.
I can comment real quick. So as I said, I was not going to do surgery. So I actually didn't have a mentor in surgery, but what I did have was a network of people, and a lot of them happened to be surgeons. So I found that network at SNMA. So number one, this is a plug for SNMA membership. But when I found myself kind of like having to go through the SOAP process, et cetera, I called all the resources I had to help me get through that process. And when I ended up in surgery, a lot of the people that I had kind of developed relationships with just in general. So I think it's important to have a mentor in your chosen field. Obviously, they've been through what you're going through. They know the nuances of your specialty, but also don't discount having mentors who may not be in your field, because they also know people too. And so when I landed this surgery residency, I got several phone calls from people that I personally knew or friends of people who have been part of my kind of mentor team, and that were surgeons, and they've been helping me ever since I started residency. So I think it's important that you find a mentor in your specialty, but like all of us have said actually on here, all four of us have changed our minds about what we're going to do with our lives. Just realize like a good mentor can help you through a lot of things, even if they're not in the specialty that you've chosen. So.
Thank you for that advice. And Dr. Christinia, I don't know, I'm sorry, I keep butchering your name. Dr. Christinia, did you have any mentors going through your process of becoming a general surgeon?
I think that similar to some other people, there wasn't one specific person that I would say was a mentor per se. In my clinical years in medical school, the surgeons I worked with were very supportive of, when I changed paths, that's actually who I went back to get letters from, was people that I had worked with during my medical school years. And so I've had that. While in residency, there's I know every resident program does it differently, but here we try to match up more senior residents to help interns with the transition of entering residency and kind of navigating what it is to be an intern. So I was fortunate to have some of that. Those who do go into lab or research years, which was briefly mentioned, some programs have that built into their program. Oftentimes people will find mentorship during those years as well. I personally am going through a rural path, so now that I'm in my last couple of years, my mentors are people who are in more rural areas who are showing me what it's like to be in a sort of private practice area and just how to things that I would have to worry about navigating there. I will say that, I think in every every step that you take in life and throughout your training, you're going to find people around you who will be supportive, who can help answer your questions. I would say there was not a single person that I've necessarily had that that I've gone to for questions, and especially in our field, I think it's hard to find if you're looking for someone who's a female going through surgery or a person of color going through surgery. Those are especially hard to find as far as mentorship, which is why we need more people to join general surgery, because it is sort of a different experience. But nonetheless, everyone that has been around me has been very supportive.
Great to hear. Thank you so much. We will go ahead and transition to some of the questions that we've gotten in the chat. So the first question from Ryan is, as a first-year medical student, is there anything that I should be doing right now to maximize my chances of matching into general surgery?
Yes. So I think with the sort of shift that we've seen where interviewing and a lot of what we're doing is more virtual, and we might see a shift back. I think one of the things you want to think about is expanding your network. So thinking about how you can get out there and be seen, and then also, so there's a network piece. Then there's also kind of building your application. Now, you seem like the type that's very ambitious and wants to start building as soon as possible. So thinking about things that make you a well-rounded applicant, such as research, community work, leadership, and then good academics. These are all kind of the little drops in the bucket that kind of fill your bucket and sort of make you a well-rounded applicant. Now, everybody isn't going to do everything, but sort of these little things here and there will help to sort of kind of round you out as an applicant and sort of speak to what you can deliver to a program that is interested in you.
I happen to be on a lot of the selection committees for residencies, and especially last year, and especially with a lot of transitions of, lack of a better term, priorities regarding applicants and what we value in an applicant. I can say now that there's definitely a little bit more of a push towards sort of this holistic review of an applicant. So with grades and the academics are definitely very important. Seeing that someone else is well-rounded, and also exploring their own interests. So, for example, there were applicants who I distinctly remember who were still running marathons or doing things that they were interested in during medical school, or things of that nature, which really stood out during the interview process. Those sort of things, people were still doing their activities and engaging with other extracurriculars. Those were the ones who sort of stood out more than the people who were primarily academic, and I think that's been very much so appreciated and valued. Something else that let me see here. sort of slipped my mind just now. The one more thing, and it'll come up when someone else is talking. I'm sorry about that.
No worries at all. No worries at all. So thank you guys for answering that question. And I think it's definitely something that's important to start thinking about early, so that you're not kind of caught on the tail end and trying to, grapple everything together. So thank you for that. We'll go to the next question.
I'm so sorry.
Remembered.
I just remember it. I predictable. One thing that I really thought was important to see was sort of travel during the distance travel, and not the distance travel that we all know and talk about in terms of our past upbringing, but actually the ability to go to different conferences and actually meet people. We already talked about networking as one thing, but the ability to actually go to these different conferences, meet different people, show our faces to them, and kind of learn from different programs, that was very valuable and very appreciated in the selection process. Seeing people who would actually go out and really put their names out there that they were interested in a program. So I would encourage people, if you're able to, if you're financially able to, or if you're not, there are generally scholarships that are available, or if you can reach out to the program director or certain people in the program, they could work on things financially for you. But I would do my best to try and travel to national meetings of that nature, ACS, NMA, SBAS, other things of that nature.
Thank you. Yeah, that is also important as well.
And I'm sorry to interrupt you.
No worries. I'm glad you remembered. Alrighty. So next question is from Samin. Do you have any advice for a DO hoping to pursue surgery? And I'd also like to add potentially US IMG as well, especially considering our step 1 will be pass-fail.
So I can answer that. During the time that I applied, out of the last 5 to 8 years, they didn't have any DOs that were in the program. So I was kind of one of the first. And since I've been a part of the program, every year they've had a DO. So I'm excited about that. I also applied during a time when there were 2 separate matches, not the single accreditation single match that now exists. I know that having a DO in one of the rotations with me now, who's doing his sub-I, one of the biggest concerns is exactly this, is how as a DO, when we're being pushed into a lot of the primary care fields, whether by our institutions or just by way of how the match falls, can we still pursue fields such as general surgery? And I think it's still possible. I think that it has a lot to do with what was already mentioned by Dr. Robinson, that it's just your application. You want to make sure that you're well-rounded, that you demonstrate leadership, that you demonstrate involvement, and that you're really networking, because that's what's going to help get you in. It's not just going to be all about test scores, and that's the purpose of going pass-fail, so that you're not just comparing people or ranking people based off of numbers, but now you have multiple factors to contribute to your application. And really, I think networking, and if you're able to do rotations at some of those sites, which I know it's sometimes limited in the setting of COVID, which sites are allowing rotations, but being seen makes a difference on those areas that you're interested in applying to.
I'd just like to add, as a US IMG, it's a little bit harder for us than ND or DO US based because we can't do VSAS. And so our options for doing away rotations are very limited. And then you add the backdrop of COVID and they're non-existent, right? So this goes back to what we were just talking about in the last question about networking. It is going to be so important for US IMG students to network. And you want to build genuine connections. Most people, most attendings know why you probably are really interested in talking to them. But you want to build those genuine connections. And when it comes time to do those away rotations, already know, like before COVID hit, my 3rd year, like I had a list of all the places that did take US IMGs or basically had an application that was non-VSAS based. And what you want to do is get that mentor that you have and ask them, do you know someone at this program? Can you, speak on my behalf? Whatever you have to do to, within reason, to get a foot in the door, because those opportunities are very few and far in between for IMG students, whether US or not. And so any opportunity you have to capitalize on, you should do that. As an IMG, we spend a lot of money. And so at one point I just was like, you know what, we're already this far. There's so many zeros at this point behind that first number. We just got to do what we got to do. So I did go to different conferences. I definitely reached out to people in my network and said, hey, I really want to go to this conference. Obviously, it was a different focus than surgery, but nevertheless, I spoke up and said, like, hey, I'm interested in this, but financially, I can't do this. Is there any way you can tell me how to get resources or access, et cetera? So don't be afraid to speak up and don't be afraid to ask for help. I think that's another thing we as medical students don't do well. And residency kind of breaks you and forces you to do that. But be bold and be confident enough to say, I need help and this is how I need help. The people that you build that relationship with, your community, your tribe of attending levels who are rooting for you, and not even just attending levels, residents, senior residents that are rooting for you will help you, but they can't help you if they don't know what you need. So
Thank you for that. Okay, so let's go ahead and go to our next question. The question is from Chantel. Hello, my name is Chantel Upshaw, and I am a current third-year medical student at the University of Toledo. I am really interested in surgery as well as continuing to do work in the community and wanted to know how possible that is with the demanding schedule of a surgeon. Would anyone like to chime in on that wonderful question?
Oh, yes. It's not going to be easy. It's going to be very difficult. But I think that it's still difficult for other specialties too. Okay, so I just want to put it out there, especially if you're really starting your practice, starting your clinical practice, you're making inroads with in your academic department or even in your private practice department. You still will be pulled in so many different ways, right? What you really need to do is probably for the first couple years, and I just want to be honest, you may just have to deal with the start of your clinical practice first, okay? And then when you're able to renegotiate your contract or renegotiate your next plan of action, and throughout that period in time, obviously you're with the free time that you may have or what have you, you can go out into the community, you can teach, you can volunteer, you can do all these sort of things as well. But working it into your next contract, probably wouldn't do it on the first contract, but working into your subsequent contract would be the best way to really make sure that it's sort of a priority. It kind of worked out with me. I started off as 100% clinical, and then on the renegotiation or so, I added in about 10% of non-academic work. So I was able to actually add in a decent amount. That's not only is it something that I want to do, but it helps me get promoted as well. So it's something that I want to do, and it helps me. So I think that's probably the best way to go about it. Just be patient, maybe at the beginning of your practice, but you have some leverage once you show that you're doing a good job clinically, your people like you, and you're making a difference in the community that you're in. You can work it into your next actual contract on paper.
I can provide a resident perspective for those interested in trying to get an idea. I think that just like medical school, your intern year, that kind of first half of the year, you're really just getting adjusted to what it's like being a resident and being an intern, and that's difficult. Residency life, of course, is going to be a lot of hours, but there are ways that people still find to do extracurriculars. And like I'm involved in things like our diversity, equity, inclusion committees and our journal clubs that we do outside of that. and things like that. And so, and working with the medical school. And so those are things that I am particularly interested in that I still find time to do. But let's say it's something you do a few times a semester. Other ways that people have gotten or had during residency have been able to continue their community work is making it part of their research. So when you do, let's say, if you're going to pursue a more academic surgical program and you're doing those 2 to 3 years of lab or research years, you can choose to do research that's out in the communities that you're interested in. And that's another way to still be involved in the community and also get published. So a couple of different ways. And in general, you have more time during research years. It's to do stuff as opposed to your clinical years. So those are a couple of ways. Eventually, you kind of find a balance as you start to move forward in your residency.
Awesome. Thank you. Thank you so much for that. Next question is going to be, I'm sorry if I butcher your name. Is it Sola? I think, is how did you decide on general surgery over other surgical subspecialties aside from fellowship? And I know most of us are, or at least on here, are going to be current residents. So whether or not you have made that decision yet to either stay in general surgery or to then subspecialize, you can maybe talk about that. I know Dr. Robinson, you could probably talk about your decision for going minimally invasive and robotics.
Sure. So I actually started off general surgery residency with a sort of a passion for pediatrics. I thought that I was actually going to be a pediatric surgeon. And in my sub-Is, I actually did a lot of rotations in pediatric surgery. And, I thought that that was what I really wanted to do. I started residency and started doing it, and I just wasn't as attracted to it. And you fall out of love with a lot of things. That was the one for me, and I just found that I really thought that the next step of general surgery was this transitioning period of from open surgery to laparoscopic surgery, meaning more minimally invasive surgery. And I just thought it was sort of the wave of the future, especially with the emerging robot, with the new technology with the robots. I just thought that that was something that was a burgeoning field that I was really wanting to be interested in, and I was good at it too. I was teaching, attendings how to do certain cases as a chief resident, and so I just thought, this is a reasonable thing for me to pursue. I've been really happy with it so far, and there's just so much more that I don't even know about the field that I'm learning and can, plan on teaching other people. So I think just seeing the lay of the land, seeing the way the road is going, and just seeing where your passions lie, I think that's the most important.
I think the beauty about a general surgery residency, outside of like deciding that you don't want to do ortho, neurosurgery, or urology, is that outside of those, pursuing a full general surgery residency, your options are very much open. So you don't have to decide that when I'm done with this residency, I'm going to do strict general surgery. You actually have options, and the rotations or the surgical specialty is set up in such a way that you have taste tests of all of those subspecialty, surgical subspecialties. Like I'm not going to do head to toe general surgery. I think I'm going to do surgical oncology or plastics. So you being on all those different rotations, you get a taste test, and you can kind of use that to decide what you want to do. So when you enter in a general surgery residency and you are going to do the full 5 or full 7, when you come out of that, you utilize that residency to decide what you really want to do. While general surgery head to toe is an option, there are other options available outside of a general surgery residency or within that general surgery residency.
And Dr. Christina, were you going to chime in on that as well? I thought I saw you unmute.
Yeah, I was just going to comment because I think they were also asking about, aside from fellowships, like what other options, like why not urology, why not ortho? And I know it's at your exposure. So if you're able to spend some time in an operating room with a urologist or an orthopedic surgeon, then do that so that you can see if that's something you're interested in. I knew right away that I was not at all interested in hip replacements or doing cystos all the time and things like that. So I very much love the head to toe general surgery and the variety that it allows for. And as mentioned, you can still subspecialize if you so choose to after your general surgery residency.
Awesome. Many options out there. Okay. Next question is from Kayla. She says, how many away rotations students should do if they are interested in a surgical specialty? What considerations should one make when deciding where to apply for aways? I know things may be a little bit different given COVID. So if you guys can kind of chime in on that as well.
I think it's strategy. I mean, I'm a fourth year resident at this point, but a lot of the away rotations and the sub-Is that you do as a fourth year, it's important to be strategic about which ones you're doing at what given time, because you want to get letters of recommendations in time for when applications drop. So set up earlier in the year those that you're really interested in getting letters from, if that's, or getting interviews from, because it's a very short window of which rotations actually sort of matter at the beginning. After that, once you're in interview season, there's, you don't want to be on an away that you're in a place that you really want to be at, because you're going to be gone. Or, well, I guess you don't travel as much for interviews now, you just do it online, but you want to be able to be focused. So I don't know that it's so much how many. I spent my fourth year kind of traveling around to different places just to get a feel for if this is the area of the country I want to be in, if this is the sort of environment that I wanted to be in. And so it's more strategy on your application process and where you intend to be for your chosen specialty and when you think interviews fall.
I agree with that sentiment. So I was able to do aways. I was able to do aways right before COVID hit. So I was a graduating class when COVID hit, and I'd done 3 aways. So things I took into account when I was thinking about my application, building my application, and what I want to do. One, I thought about what my application so far looks like. So what I've done, where my scores fell, how I felt I fared. 2, I looked at the institution that I'm coming from. Drexel is in a big city, but it's not a well-known institution. So I kind of, in my head, I knew I needed to kind of spread out a little bit, sort of build my network and get my face out there. And then 2, I thought about where would I want to be geographically, and 4, program-wise, what am I looking for and how do I explore that? So I ended up doing 3 aways. I didn't have to, but I did because I wanted to explore different program types. I wanted to travel and see what was interesting to me, because I've only ever been in the Philadelphia, New Jersey area. Outside of undergrad, I went to Syracuse. And I wanted to meet program leadership at different institutions to sort of put feelers out there and let them know that I'm interested in their program. So I did an away in the Philadelphia area, did an away in Ohio, and I did an away up in Chicago. And it was interesting because 1, you see that the programs are different. 2, you see how the programs are, and there were programs that I liked based on my way, and there are programs that I didn't like based on my ways. And then I was able to kind of like email back and forth with like leadership and sort of set that up as well. So I think you have to think about where you're coming from as an applicant and what you want as a future surgical resident. And I think that will help guide you in terms of what to select for aways. I think now it's like you can only do one away. So doing aways were like a great part of being able to figure out what you want to do for a surgical residency.
Yes. And I'm not sure if it's any different if you have a home institution versus actually going for another institution through VSAS. You may want to, I think, check with each institution for the guests here. You may want to clarify whether or not doing a quote unquote sub-I at your home institution would be considered an away rotation. So I would just check with that as well, given COVID. Okay, so we got time for about 1 to 2 more questions. So from Joey, are you able to do any global surgery outreaches? If anyone has any options, yes. Okay.
Yeah, I can just quickly talk. I know that at the University of Minnesota, we are looking into creating a global surgery pathway specifically. We do have, I mean, obviously during COVID, a couple of the trips that are done twice a year are on hold. But, you know, some people go to Haiti, some people go to Guatemala. And I think we have another, I forget what, I think it's Uganda is one of the other places that we go to. And we also have implemented a elective rotation where you can go internationally during our 3rd year. So you get exposure that way as well. And then again, during your research years, you can do, we actually have a global surgery program leadership. So some people do research in global surgery, and we're trying to build that into some sort of pathway that you can do during your lab or research years. So definitely there are opportunities.
For sure. Global surgery is such an exciting field now. It's really kind of up and coming. Now, there are programs who have well-established like aways and electives already, and as well as curriculums. Like University of Cincinnati has a pretty well-established curriculum. There are a few up in Boston. They're all over. But now other programs are starting to see that the idea of global surgery and the idea of surgical care outside of the U.S. proper is something that can be is not only exciting, but it's viable, and it's important in terms of community outcomes and health outcomes. They're starting to really establish programs that are geared at training residents to be able to pursue that if that's something that they want to do. I would say you have to do your research. So there are programs that are well established and there are programs that are up and coming. So at Temple, we have a program as well, but ours is more up and coming. So we're establishing a curriculum. We have an away elective right now, but we're working on strengthening that. And we're doing that through working with other well-established programs elsewhere. But they're all over. They're all over.
Awesome. Well, that's good to know that is on the forefront of that. There was a question from Britt. I just wanted to make sure we got that in. She was talking about the the secondary application for residencies. Now that COMLEX and Step 1 are going to be shifting to pass-fail. Does anyone have any input on that? But from my understanding, currently it is required for general surgery applications. Something that will give more of a you'll be able to flag what your preferences are geographically, program wise. Not every program is required to participate in it, but from my understanding, all of the applicants applying for general surgery will need to fill that out, and it's just a one-time thing. It'll get sent to all the programs that are participating in that program. So just a heads up as well for that. But does anyone else have any know-how about the supplemental that is recently coming out? No? Yeah, it just dropped. So I think from my understanding, otolaryngology had done that last season, and so it showed some promise. And so I think more more specialties are doing that. General surgery, internal medicine, and I think one other, I think dermatology is requiring that. So, and I want to say that Eris or the match had recently put out some more information on that. So just look into that a little bit more. Okay, so we are kind of running low on time. So before we give our closing remarks, I'd like to go ahead and ask our panelists to go ahead and give us a one-liner for our guests regarding any advice that you'd like to partake upon us.
I'll start. So as someone who wasn't originally planning to go into surgery and plans to leave next year, if you find yourself in a tough spot on Match Monday, don't discount yourself. You might end up in a place, if I wasn't so compelled to go to OB, I'd stay at UW and continue to do surgery. They almost stole me. But just know, like, you end up where you're supposed to be, and it will all work out. As all of us have shared, none of us really came into this like, oh, I'm going to do general surgery. But here we are now living our best dream. So no matter what happens on Match Monday, cry your tears, pick yourself up, and keep moving. I promise you, you will get where you need to be.
I just want to say, and I think this is the word of the night that I've been using, networking. So I think building your network for this specialty is going to be instrumental in sort of helping you find where you land. Like we were talking about, mentorship, getting out there and being seen, getting out there and getting involved. These are all sort of ways that you can sort of build that network and establish a path for yourself, as well as establishing a place for yourself.
I would say, kind of to reiterate about the pathway, I started in internal medicine and switched to general surgery, so it's never too late. Don't give up, and if it's something you're interested in, you'll end up where you need to be, and just keep, stay vocal, stay involved, and know what you kind of want and pursue it. And that also being said, don't choose your specialty just based off of what you perceive residency life to be based off of. Residency life is short-lived. You'll be an attending one day. And there's different types of practices. So do what you really want to do in life. And many of us, myself included, we've balanced also having families during residency. So that's also a possibility for any women who are like, whoa, do I have to delay family planning? Pursue what you want to do, because that's what's important.
You guys really make really good points, so I'll say something a little different. I really want to say something about self-care. It's really important to take care of our mental. This is a really hard process to go through. Sometimes we need to take a walk and walk the dog, or hang out with our wife, or whatever it is. Take a weekend trip. Don't let this consume you. Every field actually in medicine will chew you up and spit you out if you let it. Okay, so really, pay attention to your mental, and because this will work out. You have our email addresses, you have everything you need. We'll be your contacts. We can ask us about questions, mock interviews, whatever you want to do, but just take care of yourself. And the second thing I'll say is protect yourself. Okay, so when you're in the operating room, we all know our society is not as equitable as we want it to be, and that includes the surgeons. If someone's saying something, or they're playing some music that you don't like, they're saying the N-word a lot, something like that, or at all, anything like that, speak up. You can speak up about this kind of stuff. So I really value that and want people to protect themselves, and that's how we'll make it all an equitable society. So that's all I have to say.
Well, thank you again to our amazing panelists for joining us today and giving us so much insight into the path to general surgery and what it kind of entails. We appreciate your support of the SNMA and our membership. For those of you in the audience, make sure you guys follow us on Instagram and Twitter and like us on Facebook, and our handles will be in the chat and as well on the bottom of your screen. But most importantly, if you're not a national member, make sure you guys sign up to be national members at snma.org or sign up, to sign up and get connected. Thank you guys for tuning in. And I'd like to again thank the panelists as well for taking the time to speak to our guests as well. You guys rest up. The next Sowing Seeds series is going to be psychiatry on August 18th at 8 p.m. Eastern Standard Time. So make sure you guys check that out as well if you are interested. Thank you guys again, and y'all have a great night.